Stroke is the third leading cause of death in the United States. And for those who do survive, it's a major cause of serious disability. Dr. Todd Lempert of Mission Hospital in Mission Viejo told us about the warning signs and the immediate interventions that are available.
One of the things that people need to understand is that stroke is a 911 emergency. Stroke is what we call the silent killer because people who have heart attacks have chest pain and that drives them into the ER. But people with stroke often have signs and symptoms that are more subtle and painless. So someone may have a sudden loss of vision, people may have weakness in the face or the arm or the leg, inability to speak, and these are very potentially important symptoms that need to be addressed immediately. Stroke is best understood as a kind of brain plumbing. So you have blocked pipes, narrowed pipes, and burst pipes. And in reality, stroke can encompass those three major categories. So for example, if you have a blocked pipe, you may have a blood clot lodged in a brain artery. It deprives the brain of blood and oxygen and nutrients, and the neurons start to die. You may have a narrowed pipe, which may be atherosclerosis, and that slowly chokes off blood and oxygen to the brain. Or you may have a weakened pipe and burst pipe, which may be, for example, a brain aneurysm, which is a weakening of the pipe and an outpouching, and it finally ruptures.
And what are the risk factors for stroke?
Stroke has the same exact risk factors as cardiac disease. So we strongly advise people to look at their cholesterol, to control their blood pressure, to exercise and eat healthy. Those are all strong risk modification behaviors that can lower the risk for stroke. One of the things that we need to do in this country is be more aggressive with smoking cessation, because smoking is a very high independent risk factor for both coronary disease and stroke. The modern approach to stroke evaluation is to very rapidly move into advanced imaging, because the physical exam is quite limited. And so we have very sophisticated ways to analyze stroke now. We can determine what arterial territory is involved. We can tell, using perfusion mapping, what area is at risk and what neurons have already died and what area is salvageable. We have advances on the diagnostic side and advances on the treatment side, and that's actually nothing short of revolutionary. On the diagnostic side, we have high-speed advanced scanners that can pinpoint the site of the stroke and tell us whether the tissue is salvageable or not. On the treatment side, we move patients rapidly into a treatment area, and we have pharmacology on our side, big clot-busting medicines. We have mechanical devices that can either pull the clot out or macerate the clot or aspirate the clot like a vacuum cleaner. So we have tremendous amount of expansion in our armamentarium to diagnose and treat stroke. One of the latest things that we're doing is using 3D technology in our treatment phase. We're moving to three-dimensional imaging and road mapping and advancing tools into the brain under three-dimensional guidance.